As a manual therapist, we use an approach, and we teach an approach throughout the world. We've named it Melt, Mold, and Move. This is a molding technique that will help you, individually without having a therapist, mold the deep connective tissue of the knee region. Just so we're on the same page, a joint is a space built for motion. So we have all this nomenclature, foot and ankle, knee, hip. Just appreciate the fact that bones float in a tension network. They float within connective tissue. Some of this connective tissue is extremely strong, and it does require your body weight. It does require multi-angular manipulation to really have a functional effect. So we've come up with a way to help complement manual therapy, but also help a lot of people out that may not have the opportunity to see a manual therapist. So what we're going to do is we're going to take a towel roll, big beach towel. We're going to place it behind the knee. So behind the knee means behind the femur, the tib and fib. And what you're going to see here is it's going to create a gapping. So as I bend, this will make more sense when I get down. When I bend, what happens, it creates a traction force to the connective tissue. Not only that, you can put your hand on there and not only feel it, but then you can add compression as well. So you're going to get a distraction force or a traction, and then some compressive force with your hand drive. And then we're going to use the foot as a driver on this multi-angular platform. If you don't have one of these platforms, not a big deal, you can use the floor. Allow me to demonstrate. So first I'm going to take my left foot, I'm going to go down into kneel position here, or a lunge position, put this right underneath. Sometimes you have to straighten out to really wedge it. And then what I'm going to do is very slowly, I'm going to lunge forward. Then I'm going to take my hand up over the knee. At no point in time should this create pain. Typically what people will feel is that motion in the connective tissue. So I'm going to hold on to that tissue and I'm going to slowly bring myself forward until I feel that traction. And then I can actually move my foot around, which is creating a driver from what we call the bottom up, the tibia into the femur. And that changes the angulation of stress within the connective tissue. I can also go in circles. So I often teach this to clients, patients that come in to sports medicine on the floor. When we're here in the clinic, I have the luxury of using these tools, but I can also do it on the floor. You're going to see me actually have the ability to get up over my foot and ankle. So it's creating that traction. I can also get my thumbs in there. For those of you that suffer from patellar tendonitis, you can get in there and push on that connective tissue. And then can also angle it. So I got a little bit more force on the medial column of my foot. Now the lateral forward. You actually feel the tissue and the joint space separate. Nice little soft elastic bounces is the key. You can also get on the tissue and spread the tissue. So we recommend doing this quite frequently, especially if you're experiencing soreness in your knee. It's a great home mobilization to help complement other forms of manual therapy. If you like this, please share the video to others so we can have healthy, happy knees.